mainly to a great success of combined liver kidney transplantation during this pandemic. This COVID pandemic is scaring everyone in the country, but during that time, a family from New Delhi, our capital, they traveled through air ambulance. The patient was very sick. They traveled trusting us for transplantation. They came all the way to Gleneagles Global Hospital, Chennai, and we have performed combined liver kidney transplantation. This is the first in the country, because combined liver kidney transplantation, the wife of the patient has given liver, half of the liver, and we implanted that, and the kidney is given by his sister. So this shows our family values, Indian tradition. If one person is sick, the family comes together and they help each other. So this once again tells, during the pandemic time, all the families has to be unite. And at Gleneagles Global Hospital, we are still performing these complex surgeries. So far we have done 26 liver transplants, including 8 pediatrics, children from 1 year to 12 years. We have done 8 transplants, and all with good success. So thank you very much once again.
Combined liver and kidney actually in the transplant பண்ணது ரொம்ப சேலஞ்சிங்காக இருந்தது. ஏன்னா இந்தியாவில் இந்த கொரோனா டயத்தில் கம்பைண்டாக ஒரு லிவர், அவங்களுடைய ஃபேமிலி மெம்பர், அது அவங்களுடைய ஒய்ஃப் ஒரு பார்ட் ஆஃப் த லிவர் அந்த பேஷண்ட்டுக்கு கொடுத்தாங்க. அதே மாதிரி அவருடைய சிஸ்டர் கிட்னி டொனேட் பண்ணது. இந்த கம்பைன்டு லிவர் அண்ட் கிட்னி டிரான்ஸ்பிளான்ட் சக்ஸஸ்ஃபுல்லாக இந்த கொரோனா இந்த பேண்டமிக் டயத்தில் பண்ணது இதுதான் ஃபஸ்ட் டைம் இன் இந்தியாவில். ஸோ இதுக்கு இது ஒரு நல்ல டீம் எஃபர்ட். ஸோ ஐ ஹவ் டு தேங்க் டாக்டர் ரஜினிகாந்த், டாக்டர் முருகானந்தம் அண்டு டாக்டர் செல்வகுமார் அண்டு டாக்டர் முத்துக்குமார். இவங்க ஹெட் ஆஃப் த டீம். இது இல்லாமல் இவங்க கீழே அனைத்து நிறைய சப்போர்ட்டிங் ஸ்டாஃப்ஸ் அண்ட் எவ்ரிதிங் டெக்னீஷியன்ஸ் நிறைய பேர் இன்வால்வ் ஆனாங்க. இது இந்த சேலஞ்சிங் டயத்தில் பண்ணதில் எங்களுக்கு சந்தோஷம். 2 பேரும் இப்போ நல்லா இருக்காங்க. நார்மலாக இந்த மாதிரி டிரான்ஸ்பிளான்ட் பண்ண பிறகு கொஞ்சம் ரொம்ப சிக்கான பேஷண்ட், இந்த பேஷண்ட் டெல்லியிலேருந்து வந்தப்போ ஏர் ஆம்புலன்ஸில் தான் ஷிஃப்ட் பண்ணாங்க. அன்கான்சியஸாக இருந்தார். அவருக்கு என்ன நடந்ததுன்னே தெரியாது. டிரான்ஸ்பிளான்ட் முடிஞ்ச பிறகு தான் அவர் கான்சியஸ் வரப்போ தான் அவருக்கு இந்த மாதிரி டிரான்ஸ்பிளான்ட் நடந்தது. அந்தளவுக்கு அவர் சிக்காக இருந்த ஒரு சேலஞ்சிங் கேஸ் எடுத்து பண்ணியிருக்கிறோம். இவர் 2 வீக்ஸில் டிஸ்சார்ஜ் ஆகிட்டார் டிரான்ஸ்பிளான்ட் முடிஞ்சு. அதே மாதிரி கொடுத்த டோனரும் அவங்களும் கிட்னி டோனர் 3rd டேயும், லிவர் டோனர் 8th டேயும் டிஸ்சார்ஜ் ஆகி இவங்க எல்லாருமே இப்போ நல்லா இருக்காங்க.
Chance for us to establish ourselves as pioneers and leaders in the healthcare industry. Today we are gathered here to celebrate another significant milestone, the first ever successful combined live donor kidney and liver transplant during COVID-19 pandemic. A case of GGHC's expertise, selfless family donors, and a recipient with renewed hope in life. Delhi to Chennai, a journey from despair to hope. I welcome you all to this special event on behalf of GGHC, and a warm welcome to all the family members, senior leadership team, clinical team, media, and my dear colleagues of GGHC. We have come to the most important part of today's program. Let us hear from our clinical team. It's an honor to invite Dr. Joy Verghese, Director, Department of Hepatology and Transplant Hepatology, to give an overview of the medical aspects of this patient. Over to Dr. Joy.
Colleagues, friends, the nursing staffs, and the managers and secretaries, and the media peoples, and the Indian Mittal's family, and all. I know Mr. Mittal almost 1.5 years ago. When he approached us, that time, he's a young chap actually, that time 34 years old. Unfortunately, he had advanced liver disease that's called cirrhosis, and with the renal failure. We told about the need of combined liver and kidney transplant, and we registered in cadaver liver transplant, the waiting list. as they are from Delhi, they went back. Most of the time, his brother-in-law, Mr. Shreyas, usually he will send a SMS WhatsApp to me about his clinical status. If you go through that lab report, always his hemoglobin level will be less than 5. He received multiple transfusions in Delhi because of the blood loss. The reason for blood loss, the two reasons, one is the liver cirrhosis, second one is because of the kidney disease. His platelet count, even though numbers will be the quality of the platelet is important for the blood clotting factors. So very poor function. I think approximately more than 40 to 50 units of blood transfusion he would have been received in the last 1 year. This time when he approached us, that time the family member told he is in ICU and he was very sick and the doctor has told need of combined liver and kidney transplant, emergency, but unfortunately he is not medically fit because his cardiac function, in echo we can show the ejection fraction, that was 35% due to sepsis. So he was on BP supporting medicine and the low cardiac function, he has advanced liver disease, on dialysis and blood loss. So then they contacted us and we coordinated with the ICU doctor, with our ICU in charge, Dr. Silva, through them, how to shift the patient from New Delhi to Chennai, how safe it is because he's on BP supporting medicine, obese, almost 130 kg was there approximately, and not a conscious state. So they coordinated very well, the team from the Delhi doctor and the transport, that air ambulance, the medical team and with our team. When our emergency doctor team, Dr. Sriram, and they coordinated very well to transfer the patient safely from our Chennai airport to here. So when he came here, he was totally the semi-conscious state. We admitted in our ICU. We told to the family member, he needed transplant, we agree, but at present he is not medically fit for surgery. Then they asked us what to do. We gave the option, better to evaluate because he needed combined liver and kidney. We needed 2 donors, for liver 1 donor and the kidney 1 more, the relative donor. His wife came to donate part of the liver because I still remember, because the one and a half year before when the discussion came, that time she was pregnant. So then they said, yeah, now she delivered, the baby is 1 year old. They asked whether now whether she will be fit for to undergo the donor surgery. So our surgical team, everyone assessed. We told, okay, she is medically fit. Then more affectionate, his own sister, okay, she came, she was most of the last 1.5 years, she is traveling from there to here. She came forward to donate a kidney. And until the day of surgery, we are not given any promise to the family about the success of the surgery, frankly, because we said patient is not conscious, on BP supporting medicine, 24 hours, not the regular dialysis. Normally, regularly we do dialysis 3 to 4 hours per day. Here, the patient was on 24 hours continuous dialysis before surgery, 3-4 days. And he had an infection, for that we controlled. And they have a lot of more confidence with us. Finally, I can say thank God, and their confidence won it. And now he is well. He underwent successful combined liver and kidney transplant because of our team. So our team members everyone will tell about few words about that thing. And I'm really, grateful, and I'm very happy. This was really challenging, and it's developing more confidence with us, our team also. Okay, this all we can do as a team, as a good team there, and after seeing the good outcome, and by proper the management rights, we can be successful. Thank you so much.
And good afternoon, especially the media people. Mainly why I'm telling is, during the pandemic time, the corona time, everybody is worried about coming to the hospital itself and performing such a complex surgery. We should at least tell all the people that hospitals can perform complex surgeries in the pandemic with the coordinated efforts. So we have to propagate that. Otherwise, many people will be thinking, a lot of patients will be thinking, no, nowhere the surgery is doing, so we'll stay at home. That is more danger than coming to the hospital. So with that, I'm telling this success of this Mittal's case goes to all the teams. I have to mention the teams include when Mr. Mittal's sister came and approached me, she really begged, sir, my brother has 2 young kids and somehow you have to save him. There is no other option. You have to save him. We are all here. How many months you want? We will stay here, but you have to save him. So then Dr. Joy, Dr. Selva, and because he needs kidney transplant, we approached Dr. Muruganandam, Dr. Muthukumar also. So we all formed a team and we discussed several times, not even once, multiple times, how to save sick Mittal from this problem. So we planned, and so it was a coordinated effort. Wife has kindly agreed for liver, and sister is donated the kidney, as Dr. Joy mentioned. So this shows the family values still there in this era in India. So that is very important. Normally, combined liver kidney means we take from cadaver organs. That is, whoever is brain dead, we take the liver from that patient and also kidney from that patient. Usually that happens. But living related is difficult because we need 2 donors same time. It's very difficult task. It's not that easy. It happens once in 5 years or once in few years. So I have to thank the family for the persistent effort that they had to save Mittal. And because of that persistence only, we could get the confidence and we could do the surgery. And I have to thank in this success the theatre nursing team, Anita and his team, Sham, everybody worked tirelessly 18 hours. We started morning 8 o'clock. We finished early morning 4 o'clock only. Combined liver and kidney, both transplants. We finished next day morning 4 o'clock. That means a lot of stamina and many nursing coordination has to be there. And also I have to thank ICU in charge, Jenny and his team. And for this coordination, Clara, I had mentioned, she has also done a great job. And with all this effort, we could do this case successful. And thank you once again, Mr. Bhaskar Reddy, for arranging this event, because this we have to show to people that we still do complex procedures with coordinated effort. Thank you very much.
Coming here. So I will just emphasize a few points in addition to what Dr. Joy and Dr. Rajini emphasized. So basically, the corona precautions, the COVID precautions, which is there in everybody's mind. We have been doing transplants since after the COVID pandemic. We have been doing since May, and tremendous efforts have been put by the nursing staff, by the administration, and everyone involved to make it very safe. You know, the patients will be immunosuppressed, and there is a live donor involved here. So we have to take all sort of precautions to make sure that everything remains safe. We have a dedicated team of critical care specialists and the nurses who are exclusively involved only in the transplant, who don't go anywhere else. And for the last 6 months, the staffs are staying here, away from their family and friends, and we have to thank them for their dedication. And also we have a dedicated liver unit in the second floor, which is away from the rest of the hospital, which is only catering to the liver transplantations, so that we avoid any cross contaminations. So the fact that it's a lot of small factors put together, so that helps us, and with cost base we have been very safe through the entire last 6 months, not having any incidents of hospital-acquired infections in the transplantations. So coming back to Mr. Nitin, he's been a fighter, he's been a strong guy, he's been motivating us through his stay here. When he came here, he was very sick. He was on BB medications, and he was having a lot of excess fluid in his body. So we had a lot of challenges pre-operatively and after surgery. So we employed advanced cardiac output monitoring, which measured his blood pressure and cardiac output on a second basis. That helped us to improve his blood pressure and remove his excess fluids. And it's a challenging situation for everyone, and we are very happy that it turned out well and very successful with all the efforts. And the last thing I want to say is the family support. Of course, Nitin by himself is a very strong guy, and he's been, very focused and motivated. Sometimes, even when we are down, he pushes us and says, "No, doctor, I'll be okay." So the family, both the donors, classically, the moment we make them woke them from their anesthesia, and we were explaining to them everything is okay, so you'll be doing well and all that. The first question they asked was always Nitin. So that is the level of dedication and focus they had. And every family discussions, updates we used to have, it was always about Nitin. So of course Nitin was doing well. So, but still, the donors were so focused on his well-being, and the family was always there in the post-op, and every day we meet and we say, whatever it takes, please get them there safe. So I think we should dedicate his recovery to the family's perseverance and dedication. And I hope he will do well for a long time and take care of his young kids and his family. And with that, I say thank you. Thanks a lot.
Dr. Joy, Dr. Rajinikanth and Dr. Silva has nicely put. We, as a kidney transplant, Dr. Muthukumar and we together, we were called by Dr. Joy and Rajini to tell this is such patient has come, because the kidney, we decided in this pandemic we'll wait till the peak come down, then we were actually postponing our only kidney patient. So they requested this patient is sick, we have to do combined kidney, both live. So we, Muthukumar and we discussed, we called the donor and in counsel. The overall positive outlook from the family gave the team strength comes from the team itself and comes from the internal and also the external force. The internal source we were already doing. We have done decent number of combined kidney liver, both cadaver and live in the past in the same hospital. But this was the one is the patient already sick, has to be airlifted, and this pandemic. But I had a very good confidence because liver, they had the entire floor, second floor completely, which is separated from the other. So we had a confidence. Then all our kidney transplant whole members, we underwent COVID test only for this, because we were not doing transplant. We did all of us, probably close to 15 members, Dr. Muthukumar, including dialysis technician, our theatre nurses, our physician assistant. So we all of us underwent the test. We to take care of all the precautions. As Selvakumar rightly put, not only the patient, but also 2 donors and their families also involved. They should not acquire the COVID here, so that was another challenge. The specific challenge which as a surgeon, Dr. Muthukumar also will explain the workup. And for us the challenge was 2 things. One, the Nitin's sister, she is overweight and she was towards the obese category. We did all the tests. Surprisingly, all her other tests were very good. Her heart condition, lungs condition, her kidney function on both sides, and more than everything else, she had a positive mental attitude and that single-minded conviction to save him at any cost. Whatever to be done to saving, that gave us the positive. And doing such complex surgery, because it will go long surgery, recipient, liver donor, liver recipient, then the kidney donor, kidney recipient. So we were prepared for that, and the theatre nurses also has to be specifically arranged for it, because once you come there, they have to be away. So Dr. Selva has made a very good protocol. In fact, we had the first meeting we interacted through the internet. We did not even meet, because they were already seeing the taking care of the corona patient. After we did the case also, we were spending less time with the patient, less than 15 minutes contact, so that we were seeing our emergencies and non-neurology who had emergency care. So regarding the renal donor, she was obese, her workup was the surgical issues where it may take longer time, she may have little longer time to recover. On the other side, kidney, she has to take care with more vigilance than the normal. All these things when explained, she undertook, and she gave us, so I'll be alright, you undergo. Luckily, we could do the minimally invasive manner. We retrieved her left side kidney by the keyhole technique. And by 2 days, she was almost all right. Same day, she was taking food. Next day, she was able to be ambulant. Second day, she was fit for discharge. So, and she was taking care of the other family members. We were happy to see her progress. And even Nitin also is, now he looks less weight. That time, more fluids and so since the liver people, they use the right side abdomen, we have to place the kidney on the left side. And that also some challenges, but fortunately, in spite of all the odds, your BP was low, Dr. Selva was having a big team to maintain the BP with multiple monitors. Still, after the implantation, the kidney started from the first minute itself. That gave a big hope to all of us, because as Dr. Joy told, the kidney function will help the liver function also to recover faster. So that was a positive. Luckily, all the other things like wound infection, nothing happened. No, both of them recovered very well. So thanks to God, and this whole support came from the family. It's a good opportunity to serve such family, and I thank Global to offer us such a good platform and such a complexity of the procedure, to give the confidence to do such procedure. And of course, the renal liver team is one of the best here. We work together. So thank you all the people here. I would like to thank our physician assistant and our Dr. Karthik, who is with us, who was taking care of the Nitin, and Naveen and Vimal, who was the physician assistant. Then Rajesh, he came from the general side for the donor. And of course, the kidney part, the liver nurses are taking care very well. So it's a huge effort, but at the end, we are all feeling very happy to see you recovered very well. Thanks all of you. Thank you.
Thanks for coming. Thank you, Nitin, Mittal and family. So, at the outset, I would like to thank our global management and Dr. Alok Tullar, our COO, who's not here, and Dr. Clara, nursing superintendent, for giving us an extraordinary infrastructure and the platform to work here. And Dr. Muruganathan has highlighted all the difficulties which we faced in working up the donor and working up the recipient. Yes, we underwent the COVID testing before surgery for him, and our dialysis technicians in particular, we all gave the COVID thing, and I was praying to God that none of us should test positive, and God was with us, and we all tested negative, and we were ready to treat Mr. Nitin. And Dr. Joy and Dr. Selva and Dr. Rajinikanth was the sheet anchor for us in motivating us for doing this complex combined liver kidney. And we did almost many number of combined liver kidney transplants, but this was a special situation where COVID scenario on one hand and dropping blood pressure and sepsis on the other hand. So when he came from Delhi, he was having very low blood pressure and he was on many supportive medicines for blood pressure. And he had a perm cut for dialysis, and that got infected, and that was growing a fungus, which was a very rare situation for somebody to have. So we removed the perm cut immediately, and we placed a temporary catheter, and we maintained his blood pressure. And another important point is that working up the donor in a very short span of time. So the family was so supportive, and whenever we used to call, the family used to come, the donor used to come. And I would like to thank our nuclear medicine department for doing the DTPA scan, which assesses the separate kidney function of the donor. So I would like to thank Dr. Arvind, who did extraordinary steps in doing the DTPA scan, and our radiology department, Dr. Dinesh, and all the allied consultants who gave fitness and for the donor. And I think we could finish the donor workup in 2 days, I think. And her motivation, I think, and her confidence, I think, was the best thing in the success. And coming to the surgery, I think after everything was fixed, and if you remember right, Dr. Jai knows, I think we planned a date for surgery, and unfortunately we couldn't do because neurologically he deteriorated. And we have to wait for 1 more day, and we have to do a CT scan again to confirm things are right. And then we went ahead. So on that particular day, proposed day, in my rounds I saw a donor, both the donors sitting in the same room, and I was really worried at that particular day, but they gave the confidence to me, and they had their prayers, and even I had my prayers too. And I couldn't believe myself that the next day we took him for surgery. And as Dr. Rajini said, it was a prolonged surgery, and we were all in theatre waiting, Dr. Mohanandam and me waiting for the liver to be completed. And we were very happy how the liver surgery went on. And Dr. Selva and his team, Dr. Ilango, Dr. Karthik, the team of anesthetists, I would really like to thank them, because he was on 3 supportive medicines for blood pressure, and we were running continuous dialysis even during surgery. And I was very worried but his dialysis was smooth, and I would like to thank my dialysis technicians who worked day and night in dialyzing him. And after everything, as Dr. Mohanandam said, immediately after surgery his urine output was good. Mostly in people with low blood pressure, the kidney may not function immediately, but in Nitin's case, kidney functioned immediately, and we were able to stop dialysis in 6 to 10 hours after surgery. And he didn't require dialysis after that. So his kidney function remained beautiful from that point of time, and his urea and creatinine also remained stable from then on. And liver and kidney requires 2 different tune of immunosuppression. Liver needs a different type of immunosuppression, and kidney needs different type of immunosuppression. And Nitin got another fungal infection after transplant. So me, Dr. Selva, and Dr. Joy as a team, we have to coordinate, and we have to put a lot of efforts in streamlining the immunosuppression. Every day we used to meet, and we will adjust the dose of immunosuppression. We saw to that infection is getting controlled, and the rejection doesn't happen. And so that fine tune of balance we achieved with good team effort, and Dr. Muranam and Dr. Rajini saw to that surgically things went on well, his wound healing was well, and surgical drains were taken out as planned. And definitely it was a huge effort by the team, and I would like to thank our management and the family who gave us the confidence really to work on, and from now on we are ready to handle any such complex patients. Thank you.
सबको नमस्कार। मेरा नाम मित्तल दिल्ली से। मैं 4 साल से लीवर और किडनी से परेशान था तबियत के खराब। लास्ट ईयर 2019 में किसी ने मुझे बताया कि डॉक्टर जॉय से आप मिलिए, आपके लीवर किडनी की सारी प्रॉब्लम दूर हो जाएगी। मैं ग्लीनेगल्स हॉस्पिटल आया और डॉक्टर साहब से मिला। डॉक्टर साहब से मिलकर डॉक्टर साहब ने मुझे इतना कॉन्फिडेंस पैदा किया कि आपका 98% सर्जरी सक्सेस होगी, यू डोंट वरी, आई एम वेटिंग फॉर कैडेवर। मैंने बहुत महीने यहाँ रुका, फिर डॉक्टर साहब ने कहा बैक टू दिल्ली, आई कॉल यू। डॉक्टर साहब ने 2 बार फोन दिया है, बट मेरी अनलकीली वो कैडेवर की डेथ हो गई, हार्ट प्रॉब्लम हो गया था। और डॉक्टर मुत्तुल ने मुझे देखा, पहले से रेगुलर कर रही। मैं बस इतना ही कहना चाहूँगा कि मेरे लिए ये हॉस्पिटल जस्ट लाइक ए टेम्पल है और डॉक्टर्स इज गॉड, ऑल डॉक्टर्स।
जैसे भगवान ने मेरे भाई को ठीक करा और डॉक्टर टीम के लिए मेरे पास कोई शब्द नहीं है। मैं क्या बोलूं, बस थैंक यू।
मैं आपसे क्या बोलूं, मैं तो बस ये कहना चाहूंगी कि डॉक्टरों ने इनको बिल्कुल ठीक कर दिया, पर डॉक्टर हमारे लिए भगवान है। बस मैं ये कहना चाहती कि बिल्कुल ठीक हो गए, बस यही है और कुछ नहीं कहना चाहती मैं, ना मैं कुछ बोल सकती। बस यही कहूंगी कि सब ऐसे डॉक्टर सबको ऐसे ही ठीक करें और ये बिल्कुल ठीक रहे सब। जय श्री राम।